Hey guys, I'm going to be talking about obesity prevalence in Native American children. Does family-centered education make a difference? Native Americans are at an increased risk for developing obesity compared to other populations. Obesity rates and prevalence are also high among Native American children and have increased over the years. As we know, obesity is associated with many adverse health factors, such as hypertension, type 2 diabetes, heart disease, stroke, and also mental health disorders. The current practice is to treat obesity rather than prevent it in this population. The literature supports including the family in education provided about healthy lifestyle factors. Tribal elders are also important in the Native American culture. An article I looked at discussed the importance of returning to previous methods of exercise and healthy eating, such as riding horses, gardening, and celebrations and powwows. The literature suggests that the most beneficial education for reducing obesity in this population should be aimed towards physical exercise and healthy eating habits. I'm proposing an evidence-based project to investigate the effectiveness of including the entire Native American family in education about healthy lifestyle promotion. A pamphlet would be provided to participants about ways to eat healthy and increase physical exercise. The information would also be relevant and considerate of the Native American culture. After the education and pamphlet are provided, a brief survey would be conducted to determine how important family is for the Native American participant and if they think including the family in healthy lifestyle activities would reduce their family and children's risk for developing obesity. Family plays an important role in the Native American culture, and nurses play a key role in providing education to Native American communities and populations, especially about promoting healthy lifestyle habits. The information gathered from this study could highlight the need for nurses to include the Native American family and their children when providing education. Family-centered obesity prevention education provided by nurses may reduce the prevalence of obesity in these children and encourage future and current Native American generations to thrive.